Welcome everybody. Thank you very much for joining us today for an opportunity to ask questions and find out more about the work of Action for ME. Before we start, I just thought it might be quite good to introduce my colleagues who are helping in the background today, and it also puts a face to a name some of you might have come across on social media, various other forums. So I'm just going to ask Sam to start by introducing himself.
Hi everyone, I'm Sam Bromley. I am the Participation and Influencing Officer at Action for ME.
And I'm Ellie. I recently joined Action for ME as a Marketing and Comms Officer. In fact, this is my third day, and I've had ME for 15 years.
Hi everyone, I'm Danny. I am the Marketing and Communications Officer for the Decode ME big genetics research project. It's something I'm hugely passionate about because I have ME myself and I'd signed up last year.
Hello everyone, I'm Ruth. I'm the Operations Director and Deputy Chief Executive here at Action for ME. I'll also be managing the questions later. Thank you to everyone that's sent questions in advance. We will do our very best to respond to all of those. If you would like to ask a question during the session itself, there's two ways to do that. You can either use the Q&A function, which should be available at the bottom of your screen, and type your question there. Alternatively, if you'd like to ask a verbal question, please raise your hand and then we will allow you to speak when it's your turn. Thank you.
Thank you, everybody. So in a moment, my colleagues are going to disappear and Ruth will join me after the presentation. And I think, Sam, you're going to let me share my screen. Okay, so I've pulled together a few slides for you, and this film will be available afterwards for people, if anybody wants to watch again, or if you want to read through some of the detail of the slides, and also for people that haven't been able to join us today. Some of the slides are a little busy. I have done that deliberately so that there is a bit of context there. Otherwise, the slides are quite meaningless for those that haven't been able to join and maybe aren't able to watch the film, but just want to read through the slides. I'm going to say a little bit about Action for ME and then give you a very brief summary of some of our work over the last 12 months. And say a little bit about our plans for this year and the future, and then there'll be time for questions afterwards. So Action for ME came into existence in 1987, so we're over 30 years old, and our vision is a world without ME. Our purpose is to end the ignorance, injustice and neglect experienced by adults and children with ME. And we do that by providing support to improve the lives of people with ME now, whilst we're working to secure change for the future. We have 4 values that we work with: empathy, clarity, courage and collaboration. And whilst I might be biased, obviously, as Chief Executive, I do think that we try very hard to ensure that those values are evident in our behaviours and the work that we do across all of our activities. In our previous strategy, which ended last year, we had a split of about half of our work and resources went into our services to directly improve the lives of people with ME. About 30% of our work was focused on inspiring action at all levels. So that was our awareness, our comms work, our medical education work, influencing work, policy work. And about 20% of our resources and activities were focused on investing in change, which includes our research and raising funds to be able to deliver the services and other activities that we do. We took a decision this last year because of the pandemic, rather than to launch a new 5-year strategy, to actually focus on being here for people with ME and to pause while we try and work out what's going to happen in the future. There were too many uncertainties for us to actually set out what we wanted to achieve over the next 5 years. So at the moment, we're working in between strategies, which means that there is a bit of a lack of absence of information for you about what we're doing this year. And that's really why we wanted to have an opportunity to share some detail with you now, but also we have our AGM in September, and you'll hear a lot more about what we've done in the last year and also what we plan to do going forwards. On the 1st of April last year, we quickly adapted to the changing environment, and we took a decision because we saw the demand for our services increase by 3 times previous levels. And so we decided really to focus on providing services, being there to support people at a time they needed it most. And we had a whole range of different issues coming forward and needs coming forward as a result of the pandemic, alongside all the other things that people were contacting us about previously. So I'm just going to share with you a bit of a flavour of what we've been doing. It's not possible to share everything, but please do join us for our AGM when you can hear a bit more. So I'm not going to read through all of the things on the screen. I want to tell you a little bit about our crisis support and advocacy service that we launched on the 1st of April last year, and we're just about to change that. Now we're out of the immediate crisis. It will become the information support and advocacy service. What we found was that not only was there an increase in demand for support, but actually the complexity of the situations and experiences that people with ME had changed quite drastically. We have received an increase in suicidal callers. We had contact from people that had been left sometimes for days or longer without carers going in, not being able to get up and go to the bathroom, not having eaten, not being able to get access to shopping deliveries because obviously the demand increased significantly. And so our team at the time responded to nearly 1,800 inquiries around a whole range of different issues and needs. Alongside that, we've had information on our website and resources that people have been able to access. We decided to roll out what was then a pilot of our advocacy service, which we were delivering in the Southwest and the Midlands. That's now available across the UK. We have, over the last few months, significantly invested in our advocacy service so that we have a lot more staff in the service being able to respond to needs. And we're also transitioning our 5-year peer mentoring project in Scotland. So our colleague Avril and our peer mentors and a whole raft of new volunteers are now working as part of the advocacy service, but focusing specifically on meeting the needs of people living in Scotland. So whilst the numbers were not as high, we worked with 53 adults through the advocacy service and 168 families through our children and young people service. We found that the time we needed to spend with people and be alongside people was a lot more than we originally anticipated. And we feel very strongly that that's an important element of our service going forwards. We have had waiting lists of around 12 weeks, which really is not good enough if you need urgent support. And hopefully, as our new colleagues that have joined go through their induction and training, are able to help us be there and to reduce those waiting lists. We've also invested in our children and young people's area of work. So we now have, for the first time, a children and young people's advocate will work directly with children and young people. And we have a colleague who works with parents and with families, and we're looking to expand that over time. As you can see, our satisfaction rates have been high, and we have been able to demonstrate the difference we make through increased understanding of rights, increased knowledge, increased self-advocacy, increased health, etc. We've had a piece of work that we've had funded by Children in Need to run some workshops, our Breaking Isolation workshops for children and young people, and they're actually now continuing over the next year or two. We've had 24 young people in the last year, in 2021 to the end of March, 2020 to the end of March 21. We've had 24 young people that attended those workshops, and they're run in partnership with young people who help shape and design those workshops. And as you can see from the statistics, we've had an impact in reducing loneliness, increasing self-esteem, and also supporting young people to build positive relationships with their peers. A number of our resources, as I mentioned, have been downloaded, and they have a whole raft of information and resources available that you can access through our website. We also run peer support forums. We have one for adults where we have over 4,500 members and over 100 children and young people on our specific young people's forum. Those forums are supported by peer moderators who give their time on a voluntary basis to help make sure that people are supported, that we respond to any particular needs or issues that come up, and to make sure that people are connected in the way that they need to be. And as many of you watching now will know, we also have our Interaction magazine and our Cheers e-Zine, which is for children and families. So just a bit around our inspiring action work. As I said, this is our kind of policy influencing, education and awareness work. We ran a consultation in response to the draft NICE guideline that was produced earlier this year and had over 1,500, earlier this year, I think it might even have been at the end of last year, over 1,500 people participated in that, and that informed the response that we submitted to NICE. We are very disappointed to hear that the NICE guideline has been delayed and that will now not come until the end of August. But we do welcome the fact that the questions that have been raised are being looked into and responded to. And we hope that that means that the final guideline that comes out is robust. We also hope that given the removal of CBT and GET, that the voices and experiences of people with ME and lived experience of ME as carers, etc., is listened to, and that the final consultation is something that we can all get behind. There are a range of different activities that we've been involved in terms of lobbying and influencing, which includes responding to House of Commons Select Committee inquiries. We did quite a piece of work around access to shopping deliveries, both liaising with supermarkets, but also providing information for people to use and to self-advocate. We have written to the Chancellor around the disability tax and been involved in co-signing a letter around universal credit. And we've worked with other ME charities to provide a response regarding the use of CBT and graded exercise therapy within long COVID clinics. Our communications work is managed through a very, very small team. We've had a gap in our team. So you've just heard that both Ellie and Danny have recently joined our team. Our comms work has, over the last year, saved us, or would have cost us, sorry, £845,000 in terms of advertising value. And the reach through the different letters and articles that we've had in both local and national press is nearly 16 million. We get that data by looking at industry data that is available so that we're using the same measures and numbers that others use in the communications field. We write a lot of letters out to the press and media, and we also forge a number of connections directly with journalists, both on social media, engaging with them, but also offline. And recently we ran a briefing for journalists. We invited over 50 journalists to come along and hear about ME from myself, Sue Pemberton, from the Yorkshire Fatigue Clinic, and Glenn, one of our supporters. That resulted in 2 follow-up pieces, and I understand that there's one in the pipeline. That's not many pieces to come out of that press briefing, but it gave us an opportunity to try and see what interest that we could garner and what impact we could have, and that is certainly something we're looking to replicate. That one was specifically focused on health sector press, but we will be looking at other areas that we can focus on. We have also been funded in Scotland to undertake some medical education work, and we're delivering this with other ME charities and with Dr. Nina Muirhead, who's part of the Patient Advisory Group, and also the Medical Education Group, which is a subcommittee of the UK Research Collaborative for ME/CFS. And the aim of that is to improve doctors' understanding. We know that there are some fantastic doctors out there, but we also hear time and time again of people that have really poor experiences. And so this work is seeking to redress that. Nearly 700 professionals have completed Dr. Nina Muirhead's module as a result of our communications, our podcasts, and other material that we have put out through this project. And I'm really delighted that we've secured funding to continue this for another 18 months. We'll be looking to have 6 further podcasts and also to widen our reach to social care professionals. You can see on the screen that there have been some good differences as a result of this piece of work. 75% of clinicians felt that they had more confidence in diagnosing ME. 77% of clinicians reported increased confidence in treatment and management. And as we know, there are no treatments, evidence-based treatments, but there are different pharmaceutical drugs, etc., that may be used for particular symptoms. So it's good to hear that clinicians are demonstrating increased confidence in treatment. And 100% of clinicians reported improvement in patient-centered care and patient pathways. And that's particularly important, given a lot of people tell us and told us through our big survey of over 4,000 people that being listened to, being understood, and having open, honest, transparent conversations with their doctor was really important, and that would make a really big difference to them. In terms of investing in change, I'm delighted to say that for the first time in our 30+ year history, we have a research officer. Our colleague joined us just a month or 2 ago, and I'm really hopeful that that will help us invest further in our research work. Over the last financial year, so up until the end of March 2021, we had 2 PhD studentships that we were funding. Our research strategy is to invest in early stage career researchers. That's to increase interest into research in this field, but also we seek to leverage more funding as a result of the money that we're putting in. So for each PhD and each fellowship that we fund, we seek match funding. So the 2 PhD studentships that we have, one in Edinburgh and one with Sussex University, has got match funding. Sussex University is putting in 46,000 for their PhD, and for the Edinburgh University PhD, which is a DNA project, we secured funding through the Chief Scientist's Office in Scotland. So if you want to know more about those projects, you can take a look at our website. We have information about all of our research activity on there, and there are films available from our PhD students on the YouTube channel too. As many of you will know, a huge piece of work for us has been the Decode ME project, which officially launched in September last year. Action for ME is contracted to oversee and support the patient and public involvement and also the recruitment. So getting people to sign up and take part in the project when we launch at the end of September. What we've done is to really encourage people to become interested, to show their support, and also to be first in line to as soon as we open the recruitment. We have encouraged people to sign up through our Decode ME website. So if you haven't already and you'd like to know more, please take a look at the website and sign up. You will be first in line. That means that we will tell you as soon as recruitment launches so that you can sign up and fill in the questionnaire and see if you're eligible to take part. We've already had 25,500 people sign up and then register their interest pre-recruitment opening. And those are people that are in the UK, over 16, have a diagnosis of ME and have said that they're willing to take part. we also have a number of other people signed up from around the world. Alongside delivering those two aspects of the Decode ME project, I also sit on the management group, which I chair, alongside Chris Ponting and Andy Devereux-Cook, who's co-founder of Science for ME Forum. And we also work as part of the Patient Public Involvement Steering Group and the Marketing and Comms Group. I have to say it's a really exciting project, a great partnership, and one that has taken us 7 years to get to. Just demonstrates the slow kind of outcome of some of the advocacy work and influencing work that we have done. Our approach to advocacy is very much about getting alongside people. I think some organisations have different approaches to campaigning, and you do need different approaches to campaigning. Our approach for the Decode ME project was to be part of the research collaborative, which we helped co-found, and to work alongside the research community, the funders and the patient community to help create that opportunity. I sincerely hope that the next opportunity doesn't come in 7 years. The funders have said that this is a door opener and we are going to hold them to that. So we are continuing conversations in the background to try and make sure that that is a reality. Alongside that, we secured just under £100,000 for a priority setting partnership. This is a partnership that is using a tried and tested methodology developed by the James Lind Alliance. And it's something that's been used in a whole range of different disease and illness areas to bring together people with lived experience of that disease or illness and clinicians to identify a top 10 for research, and particularly focused on clinical research. So the Decode ME project is what we would call discovery science. The priority setting partnership, although it will touch on those areas, is very much focused at looking at treatment and clinical care pathways and what needs to change there. We all know that there has not been enough funding for research, and we all know that there hasn't been enough good quality research, and we want to see that change. A good question is, why would we want to take this money instead of putting it directly into research? But what we have seen in other disease and illness areas is that actually working together in this way creates more opportunity. It creates an opportunity to bring more funding in, and it creates an opportunity to gather more interest, and particularly interest from clinicians and from researchers, the people that we need to be able to do the research. And we don't have enough people willing to do the research in this field. And we also know that where we do have people willing enough to do the research, they're struggling to get the funding. By very fact that the Medical Research Council, the National Institute for Health Research, and the Chief Scientist Office in Scotland have funded this priority setting partnership, or the PSP, means that we hope they're going to work with us to make sure that we see those top 10 priorities turned into a reality. If you haven't already taken part and had your say, there is a QR code on the slide which you can hover your phone camera over, or you can go to the Priority Setting Partnership website. We will make sure that those are available for you afterwards. We've continued our work with the Research Collaborative, and we had a conference in March last year, and we have been working over this last year to work out what our future strategy is going to be. We've also worked as part of Forward ME, and as many of you will know, there's been a change of chair, so we're just re-galvanising ourselves and working out what our future strategy is going to be. And we've also invested in our fundraising, and we had a fantastic result with our Big Give Christmas challenge. These are some of our collaborators. One of our core values is collaboration. We always seek to do things with others where possible. There's always more that we can do, but we're delighted to have the number of partners and collaborators that we have, and we are continually building that. So just a bit about our plans for the future. As I mentioned earlier, our sort of 3 core strategic objectives are to improve lives, inspire action, and invest in change. And over this year, we have identified some core areas that we will focus on, 7 areas. We want to expand our information support and advocacy service. We've invested, as I said earlier, in terms of having more staff and having more capacity. We want to reduce waiting lists, but we also want to increase our reach. We want more people to access our services, and with a particular focus on those with severe ME and those from Black, Asian and other minority ethnic groups. We also want to increase access to healthcare and information, because that ties in really well with the medical education work that we're doing. In terms of inspiring action, we want to increase awareness and understanding and influence more decisions. That means that we're going to work collaboratively with the other charities and others once the NICE guideline comes out, to increase understanding and awareness of the guideline. We don't know what that looks like yet because we haven't seen the guideline, but those conversations are already starting. We have been in discussion and formed a formal relationship with Solve ME in the States. And one of the things that we're doing, aside from funding a 2-year transatlantic fellowship, is to develop a global health information platform. And there are a number of different models out there. And one of them that we've been looking at is HealthTree, and the link is there in the slide. It's really worth having a look at. It is a platform that was developed by somebody with myeloma, and it has transformed both the healthcare approach and research for myeloma from the bottom up, by sharing patient experience, patient stories, clinician experiences. There's a medical education strand through HealthTree University. It supports peer support. It matches people so that you can gain more understanding about different approaches of living with the illness, etc. And it's a really fantastic platform, and we really hope that we can produce something like that this year. We're continuing work with the Long COVID Alliance to lobby for changes, and we want to see all the investment in long COVID benefit people with ME. There's a really unique opportunity to understand what's happening in terms of people having their health restored after COVID infection, but also understanding why some people don't recover, not just for ME, but for other post-viral illnesses. And we will do that as part of the Long COVID Alliance. We'll continue to work with Forward ME, and particularly looking at how we can better coordinate our communications. And actually, is there an opportunity for us to work together as UK charities to do something quite bold and ambitious around public awareness of ME? And obviously to continue with the research collaborative and to ensure impact from the priority setting partnership. We'll also continue to work as part of the International Alliance, and I think there's a real opportunity at an international level to increase the visibility and profile of ME. In terms of our investing in change, we want to continue to increase knowledge through research and education through our PhDs. We have got one in the pipeline. In fact, we've got 2 PhDs in the pipeline, which we hope to say more about soon, and obviously the fellowship that we recently announced, and the 2 PhDs that will report later on this year. We want to do more involving the voices and experiences of people with ME, not just adults, but also children, young people, to influence and shape our work. And we're developing a coordinated strategy around that. We already do an awful lot. Some of that's seen and some of that's not seen. And we need to make sure that we're much more transparent about what we're doing and what we're not doing. We're working on our new strategy, and I'll share a bit on that at the moment. But to be ready for a more transformational strategy, we need to do some things about our internal capability. We need to make sure that we've got the right staff in place with the right skills, the right experience. We need to make sure that our systems and processes are better placed. Some of them are a little bit outdated and need updating. We need to make sure that we collect good quality data so we can demonstrate the difference our work makes. And we also need to be able to market ourselves better. I think we do a whole range of things that people don't see, and we're not as good as we should be in sharing that and demonstrating the impact of our work. So I'm just going to finish by saying a little bit about our future strategy. This is developing, so we haven't agreed anything yet. The board hasn't made decisions yet. I just want to share a little bit about where we are at the moment. The conversations that we have been having have been built on the need that we see through the people that access our services, through the 4,000 plus people who responded to our big survey, and also from other aspects of our work, the consultations that we're involved in, etc. And we've been having discussions around where can we have the biggest impact. We are a small charity, £1.2 million, and I think we do punch above our weight. And sometimes people think we're much bigger than we are, and other times people think that we're, that they don't realise we're as small as we are. And so we need to think about how we can use every pound that we have to have the most impact. And that's really challenging because the need is huge. The frustration, the anger, the kind of, lack of understanding, the stigma that's out there, the need is massive. And as a charity of our size, and even a charity 10 times our size, we will not be able to meet all of that need. So we have some really tough decisions ahead of us. And the conversation that we have had is around, should we be focusing on that universal, on those universal areas like research and health and medical education, because that affects everyone, or should we be taking a more targeted approach on, say, social care or employment or education, etc. And we're not sure where we're going to end up with that, and we are going to be engaging with the community to help us make those decisions. But the three things that we are asking ourselves is it important? Well, actually everything's important. Is it an urgent? Yes, most things are urgent. People have been living with these level of needs for decades in some instances. And the key question is, where can we have the biggest impact? And so that's kind of where we've got to with our conversations at the moment. And once we want to kind of develop that further, then we will be coming out and inviting a conversation with us to help shape what we end up with in terms of our next 5-year strategy. Thank you very much. I'm now going to welcome back Ruth, who's going to help facilitate the Q&A for us.
Thank you, Sonia. We'll start with a few of the questions we received in advance, but a reminder that if you would like to ask a question, please do use the Q&A function on the bottom of the screen, or you can raise your hand and we will come to you. Firstly, Sonia, a question about research. This is from Kerry. She asks, why aren't funding calls something Action for ME pushes for from the MRC, that's the Medical Research Council, when many advocates and researchers say that this is necessary?
As I mentioned, I think it's a really good question. As I mentioned in the presentation, there are different ways of campaigning, and the route that we have chosen to take is to work as part of the research collaborative, and that has resulted in the Decode ME study being funded. I know that that's not enough, but we have found by getting alongside the funders and research community that we are having some impact. And I'm not sure what would be gained by us taking a different approach. That's not to say other approaches aren't impactful, but actually we do have the ear of funders. We've actually had money coming in, and what we want to do is to continue to work with them to make sure that that increases.
Thank you. Another research question, this time from Danny. Danny says, I suggested a petition to government during ME Awareness Month demanding investment in ME research, amongst other things. Will you reconsider this proposal, which, if successful, could unlock research investment from the government?
Okay. And we know that petitions can have a big impact, but there have been many petitions in the ME field over the last few years, and certainly in my sort of eight plus years in the charity, and they have had little impact. We have to make some really big decisions, tough decisions about how we use our capacity and resources. And during ME Awareness Month, we virtually had no comms capacity. Myself, Ruth, and others were trying to manage our comms work. And so we had to make some decisions about what we could do and not do. If we felt that a petition would add anything more to what we're doing through the research collaborative and the work directly with the funders, then absolutely we would consider that, and we never say never. So if there is something that others are doing and we can be part of, or something that we feel actually the situation's changed and it's now worth revisiting, then absolutely we would do that.
And just to round off our research questions, we've had one through the live chat from Chris. It says, hi, on the back of Decode, do you envisage additional research will take place in parallel to this study or to follow on once we have the results? And what other sorts of research do you envisage or are pushing for based on what we know about ME at this point?
So it's a really good question. We would love a study to replicate what we're doing in Decode ME, and we have said that we will work alongside other scientists to make that happen. That's really important for validating the results. We will be pushing in terms of the priorities that come out of the priority setting partnership and looking at how we can get those funded and researchers interested and excited to do that research. There is, we will be having another Decode ME Q&A, so I appreciate I gave quite a sort of slim answer to that, but we can certainly pick that up in our next webinar through the Decode ME study.
Okay, thank you. Questions more related to health now. Katie's asked in advance, what are your plans for when the NICE guidelines are published? And how will GPs and the media get the patient voice rather than that of BPS, which is the British Psychological Society?
So we are working with journalists at the moment. I appreciate that there have been calls on social media for us to be transparent about everybody we're talking to. But I have to say that if we did that, then journalists probably wouldn't talk to us. A lot of these conversations require quite a lot of revisiting discussions, sharing information, meeting up with people, etc. And so those things are happening. And I have a meeting this month with one of the papers, and we're really hopeful that we can continue to push for some good coverage from the when the NICE guideline comes out. In terms of the biopsychosocial model, we are very aware that there is still a push in some areas around the use of CBT and graded exercise therapy. We are very clear that there is not an evidence base for their use. The draft guideline removed them in terms of a recommendation. There are huge criticisms around the PACE trial and other pieces of research that have come out, and we will work with the NICE guideline. And there are varying views, differing views, but our view is that we have to get behind the NICE guideline, and we should do that with as many charities and others as we possibly can. And I hope that includes the NICE implementation team, who have a responsibility to get their guidelines out there. So as that develops, I hope that we'll be able to share more about that, but we will work collaboratively with as many people as possible, because it's important that we take a united approach to this.
We've had a few questions around comorbidity, and I hope those who sent these in advance will forgive us for blending them into one question. But we know from lots of people that there's a range of comorbid illnesses for many people with ME. How can Action for ME ensure and be proactively involved in ensuring that people with ME are aware that they may also have other comorbid conditions that they should be tested for?
So we try through our resources, through our website, and through the information that's given by our colleagues in our information support and advocacy service to encourage people to always go back to their GP if they've got symptoms that change, and we know that there is fluctuation with ME symptoms. If there's something that's new or different, to discuss that with their doctor. There is information about comorbid illness in some of our resources. There is quite a lot of research taking place around other comorbid illnesses. I don't have time or information to hand to be able to share all of that, but certainly looking at something like ResearchGate or on the Science for ME forum, we know that there's a lot of research that's happening as a result of long COVID. So there was a paper in March about POTS, And we also know that some of the ME researchers like Julia Newton have undertaken research in POTS too. There's research around fibromyalgia, and also Sjogren's that Fai-Ung has undertaken in Newcastle. So there is quite a bit of research out there. What we try and do through the Research Collaborative is make sure that we link up with those researchers, and certainly we have had a range of people at previous conferences and also through some of the presentations.
And Carol's asked through the live chat, Action for ME is 34 years old now, and yet you seem to be deciding what you stand for and priorities now. What's been happening in this time?
So it's a good question. The way organisations tend to work is that you develop a strategy for your work for the next however many years, maybe a year, 3 years, 5 years. So that means that we continually refresh and review what our priorities are. We actually do that every year and see whether we're still focused on the right things. And of course, the right things depend on which lens you're looking at it through. And so what I shared today is what we're looking at for the next 5 years. The work that has been done previously through the ME Observatory, which was National Lottery funding for, it was £500,000 for research, will have been decided upon based on what funding was available, what the needs were at the time, who was involved in the charity, what people were telling us that they want. So we are now looking at what our priorities will be for the next 5 years. And when we get to 5 years' time, or maybe even 3 years' time, those priorities might shift. And I anticipate things will change as a result of long COVID. And, we know that we're already seeing an increase in the number of people being diagnosed with ME following long COVID. So we have to make sure that we remain responsive and flexible so that we can respond to emerging needs like that.
And thank you, Nick, for your question here. Sonya, how do you and Action for ME feel about the idea that's been discussed online a lot recently, that ME charities should be working together more, perhaps through the Forward ME group, to ensure efforts are not duplicated, so more can be achieved with the resources available and a strong, consistent message can be put out to the media?
Okay, another good question. One of our values is collaboration, and I talk about collaboration at every single AGM because it is so hugely important. And I think as an organisation and as an individual, I passionately believe that we can't do this alone. We achieve more together, and that has to be our starting point, not our end point. So I really want us to be doing more. There's lots of things that we do. I speak with the ME Association, ME Research UK every 6 weeks. We co-fund things together. We're working with Solve. I hope and I believe that we're under the new chair and with Margaret still in the wings, that Forward ME will become a powerful group of the UK charities. I think that comms and public awareness could be the priority for Forward ME, but that hasn't been decided yet. And I know that Andrew, the new chair, is really keen to make sure that there's good communication and engagement once we've set out what we're doing.
Second question from Danny related to fundraising this time. Danny says, my local hospice generates 3 times more income each year than Action for ME. Blood Cancer UK invests 100 times more each year in research than Action for ME with the same amount of patients affected. You do great work, but we urgently need more. When and how will you scale up fundraising to enable Action for ME to invest millions in research annually?
I would love to raise the level of money that other charities do. And I can honestly say, having been in the charity sector for most of my working career, that raising money in the ME field is really challenging because the majority of people that give to the cause are people that are directly affected by it. And that's not the same in other illnesses. If you look at animal charities, for example, and that's not good enough. That's not an excuse in terms of why we're not raising more. I think we do incredibly well. We have a small fundraising team and they are exceptional, and we've delivered more than we expected, something like 30% more than we had anticipated this last year. So it just demonstrates how well we've done during the pandemic. Our next priority and part of strengthening ourselves ready for our new strategy is to invest in fundraising and communications, given that we've just put a huge investment into our services team, and that is really significant. So we now need to scale up our fundraising. We've got a good team that are working with us to help us to do that, and I think that the team have developed quite an ambitious fundraising strategy. That's a starting point. We need to, in the next 5 years, be a lot bigger, not for being bigger's sake and not because we want to have lots of money, but by having more money, we can invest in exactly the way that Danny has just described.
Thanks, Sonia. We're about out of time for questions. There's a couple on the live chat we haven't got to, but just to reassure everyone, we really value you sending in these questions. We will create an FAQ and respond to all of these, and we can put that out through social and contacting you through your sign-ups. Just to say, the person that's asked about finding a specialist for ME, please do feel free to contact our services, our information and support service. There's details on our website.
Thank you, Ruth. I've got a couple of days leave after today, but when I come back, I will make sure that I personally respond to all of the questions in the chat. So I know that Sam is taking a copy of those, and we will send that out to everybody that has joined us today. If there are questions that you want to ask and haven't had a chance today, then please do. You can use social media or contact us in a variety of different ways. What we will also look to do, if there are lots of questions, then we'll just run a pure sort of Q&A, whether it's on social media, through a webinar, through Facebook Live or something for people. We really do want to engage and connect. And I really hope that many of you will work with us as we develop our strategy and help identify what our priorities are going to be for the next 5 years. Because as I said, it's a really tough job and we will never get it right for everybody, but we want to try our hardest to do the very best that we can. I say that as a chief executive with a professional hat on, but also with a personal hat on as a mum of a child with ME. I'm impatient too. I don't think we do enough. I always want us to do more, and I'm really lucky to have an exceptional team alongside me that feel the same, but also recognise that we can't deliver everything that is needed. But please be reassured that we remain passionate and committed, and we will try our very best to do the very best for you. So thank you so much for joining us today, and I look forward to connecting with you all again soon. Thank you. Bye.